Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5. I'm your host, Dr. Stephanie Duger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Welcome back to Prepared for Parenthood. Today, our guest is Lynn Schulte, a pelvic health physical therapist for more than 30 years. Lynn is a principal instructor and founder of the Institute for Birth Healing in Longmont, Colorado. She has successfully helped thousands of women heal from all issues experienced after birth, including a common birth pattern she found that shows up in the pelvis postpartum. Lynn also teaches courses to body workers to help them work with the energy of the body and access and use their intuition in their bodywork sessions. Knowing we are more than just our bodies, Lynn works on all levels, physically, energetically, and spiritually, with women to help them access their full potential. She offers a certification process to help birth professionals become birth healing practitioners. Welcome, Lynn. I'm so happy to have you here today. Post-birth, I've heard a lot of women complain about painful intercourse. That's one of the biggest complaints. It's not just that I'm touched out or exhausted. It actually hurts a lot. And it shouldn't hurt.
Exactly. And I tell you what, Stephanie, I have gotten so many beautiful messages from husbands after working with their wives, because one session, Stephanie, one session, and I can get a mama enjoying sex again in 90% of the cases. There's 2 issues with pain during intercourse. One is an insertional pain and the other is a thrusting pain, or you can have both. So an insertional pain means that the pelvic floor muscles cannot stretch open to allow the penis to come in. That could be because there's scar tissue. Scar tissue is not as flexible as normal tissue, and scar tissue needs to be mobilized to learn how to lay down correctly. Now, if your bones are still in that open birthing pattern, it's putting a stretch on the muscles. And so instead of the vaginal opening being like a little circle, it's now an oval being pulled side to side, and they're on stretch. And if you have scar tissue in there, then it can't even stretch more. And so the muscles are not in a position to be able to lengthen in order to allow insertion to happen. And so no amount of relaxation, no amount of whine, and that's what they hear from their providers. They go in and it really hurts. So they're like, oh, you need a little more foreplay. You need a little more whine. You just need to relax. Oh, just give it time. And I'm here to say, please, everybody, do not wait. Go see someone who has trained with me. They will have a different approach than just your traditional pelvic health physical therapist or occupational therapist. And if they've trained with me, they know how to address the bones. They know how to help the muscles to relax so that you can have penetration. Now, the deep thrusting pain issue, that's a cervical mobility issue. So the cervix is up at the top part of your vagina. And after birth, I can find that cervix anywhere in there. It can be tucked off to the left, the right. It can be poking into the bladder, making you feel like you have to pee all the time. Or it can be tucked really far back. But the cervix needs to be like a piñata in there. It needs to be able to move in circle 360. And it needs to be able to move up and out of the way. So it's got to be able to move up and down, just like we hoist the piñata up and down. It's the perfect analogy. And so my goal when I'm working with my clients is to make sure that cervical mobility is like a piñata. And not every pelvic health therapist knows how to work with the cervix. So I just want to put that out there, that if you're seeing a pelvic health PT, most traditional trainings stop at the pelvic floor and they're not addressing the bladder and the cervix. And I have to tell you, after a baby comes out that vaginal space, it rearranges the furniture in there. One of my clients said, It's like, you get in there and you just rearrange the furniture. And I laughed. I said, that is exactly what I'm doing because I can find the bladder gets smushed off to one side. The cervix can be anywhere in there. And if you've had a child of any age, you know they never put anything back where it belongs. And the same thing happens in our vagina as they come on out. So we can help that by getting the bladder back into midline. We can get the cervix mobility like a piñata. And then we work on the pelvic floor muscles. And if I do it in that order, by the time I get to the pelvic floor muscles, they're more relaxed than when I started. So there's a huge connection between the health of the bladder tissue and the cervical tissue and the tension in the pelvic floor muscles. And like I said, I'm just amazed every single day in the clinic at the amount of change I can make in the ability of those pelvic floor muscles to relax and then contract and relax again. And so I just want moms to know this because if you have an issue with pain with intercourse, they just tell you, give it time, drink more wine. And that's not the answer. And any other problem down there, they just tell you to do more Kegels. If your muscles can't contract, it's like beating your head against the wall to get rid of a headache. Just doing more Kegels isn't going to get the muscles to function better. They're in dysfunction to begin with. You need support.
What do you see with women who've had a cesarean birth?
Thank you for asking that because there's scar tissue that is being developed in that lower abdomen. And C-section scar tissue can cause three main issues after the scar is well healed. And sometimes these issues can start somewhat close to the surgical procedure's time frame. And sometimes they don't show up till 10 to 15 years down the road. And by then, nobody's thinking that it's from your C-section scar tissue. So one thing that C-section scar tissue can cause is bladder frequency. The scar tissue is very close to your bladder. There are stretch receptors in the walls of your bladder. And when your bladder gets full, those stretch receptors get activated, which sends the signal to the brain that tells you that you need to go to the bathroom. When you have scar tissue in there, that scar tissue inhibits the bladder's ability to expand. And so those stretch receptors are getting activated before the bladder is actually full. And so we need to release that scar tissue. You feel like you have to pee every 20, 30 minutes, and you have very little urine in your bladder when you go. And so freeing up that scar tissue allows that bladder to expand more fully. So you start going more normally, which is every 2 to 3 hours we should be peeing, not less than that, with drinking normal fluids throughout the day. The second issue is that deep thrusting pain. Because there's that scar tissue in there, that scar tissue can inhibit that cervical mobility of your cervix intravaginally. And so the penis is hitting that and it's hitting that scar tissue and it's holding it in place and it feels like you're hitting a brick wall. And so that can cause deep thrusting pain. And then the third issue is low back pain. And the scar tissue is attached to the uterus, which is attached to the sacrum via the uterosacral ligaments. I have never met a scar tissue that is not tighter on one side more than the other. There is always one side that is tighter than the other when it comes to C-section scar tissue. And so that side is going to be tighter and it's going to anchor down your sacrum and not allow it to move like it needs to for when we bend and straighten up. And that can contribute to back pain. I had a friend, I have two boys, they're in their mid-20s now, but this is when they were 10 and 8 years old. Her boys are the same age as mine. And she's getting ready to go camping and her back went out on her. And she came to see me and all I did was work on her C-section scar. She got off the table and she was able to go camping. Her back pain was gone. 2 years later, she's getting ready to go camping again. And I really think she has an issue with camping, but she won't admit it. But she was getting ready to go camping and her back went out on her again. But this year, she had ACL surgery. So for 6 months, she's been hobbling around on a bad knee. And so I thought her back pain was more related to that. So I worked on her pelvis, adjusted her sacrum, worked on her knee, did all this stuff. I ran into her the next day at a school picnic and she's, no, I still got back pain. And I was like, oh my gosh, I never worked on your C-section scar. I laid her down on a picnic table at the picnic and I worked on her C-section scar and she got off the table and she's, oh my gosh, it's gone. And I'm like, it's your
Wow.
C-section scar that's causing your back pain. Now, she was a little bit more obese and had a lot of tissue in her abdomen. So it was harder to get down in and really release that tissue well for her. So I just told her, whenever your back starts hurting, get in here and massage your scar. And I tell her story all the time. And she goes, oh my gosh, tell them at work. That's what
That's
that's,
amazing. Yeah, what
yeah.
a gift. And
Well,
then she gets to go camping whether she wants to or not.
I just want women to know, and please, all of us know people who have had C-sections. And so please spread this word that we need to be massaging your C-section scar. And I have a video of how to do that on YouTube. So you can go watch that video and start doing it to yourself. Now, if you have an issue with touching your C-section scar, that could be a sign that you are traumatized from that event. And so I would really encourage you to go work with a trauma therapist. Or one of my students who have taken my birth healing intensive or my advanced course knows how to work with trauma in the tissues. And so they can help you with that. Or you could go work with a trauma therapist. But please go get support with that, because that's just a sign that you've had a traumatic response in your body if you can't touch your C-section scar. Also, if there's excessive pain in your C-section scar, that is also a sign that there could be a traumatic response being held in those tissues.
Yeah, super helpful. Are
Yeah,
there some practical things that women can do to prepare their pelvic floor for birth and afterwards that they can just do at home?
absolutely. You can check to make sure that your pelvic floor muscles have that springiness and give like a trampoline. So I like using my thumbs when I work intravaginally, because the angle of pushing down on the muscles is just so much easier than trying to use your index finger. So if you use your right thumb, you're pushing down on your left side pelvic floor muscles, and you just press down and out to the side and just see and press around in their region as far as you can and press down. If you think of your vaginal opening like a clock, 6 o'clock is where your rectum is down low. So you want to be working from 3 to 5 o'clock and from 7 to 9 o'clock with your muscles in there vaginally. Use your left thumb to press on your right side then. And you want them to just be able to give like a trampoline. If they can't, if you could just press down on them and hold them, breathe down into them, see if you can't, with intention, help them to soften and relax. Sometimes we hold tension there just because, like, your shoulders up to your ears. Sometimes you're like, why are my shoulders up by my ears? Wait, I just need them to relax. Same tension can be held in our pelvic floor muscles, and just becoming aware of that can be super helpful. Then the other thing that I would encourage pregnant people to do is lay on your side and put your hand on your anus and just put your fingers there and practice pushing and practice feeling those pelvic floor muscles pushing out into your hand, because we don't want them tightening up and in as you go to push. That will add hours to your pushing, hours to your labor, and give you a greater risk for tearing your pelvic floor muscles if you are fighting yourself by tightening your pelvic floor. Those are two things for the pelvic floor. Spinning Babies is an excellent website as well. There are 3 balancing exercises that you can do every day to help keep baby in a really good position, and inversion is one of those. So I recommend go check out Spinning Babies for pregnancy. And then postpartum, there is a closing the bones exercise that I have on my YouTube channel as well that you guys can check out, that I just wish everybody who's had a baby would do that right after their birth. Will just help bring those bones back together again. And then also, there's an oblique release that stretches out the lateral wall to help bring the abdominal muscles together. If you're pregnant and you have a separation of your abdominal muscles, you have 8 weeks to bring those muscle bellies as close together as possible, because after 8 weeks, the collagen has formed to tighten up that linea alba. And wherever those muscles land, that's where you'll be forever until you get pregnant again. And then you have another opportunity to change that. So releasing the oblique muscles, getting the recti tissues back to the midline together. It's one of the things I do in my postpartum sessions with moms. And then working on getting those recti muscles to get strong again. One of the things that I really want pregnant mamas to know is that newer research is telling us that it's super important that pregnant people keep their entire abdominal wall strong during their pregnancy. Now, there's all this fear that, oh, we shouldn't dome and we just need to be hugging our baby back up and in and not doing any curl ups and not twisting, and that'll make our diastasis worse. But actually, doing nothing is making moms worse. So I want pregnant people to understand that doing some curl ups, doing some twisting exercises is okay for your abdominal wall. And they're going to hear the opposite from everybody else because they're not up to date on the newer research. And what happens is that if you never sit straight up, like jackknife up out of bed, you lose that ability. You weaken the recti muscles, which are the ropes that the entire abdominal wall attaches to. So we want those to be strong.
Mm.
And by not doing that throughout pregnancy, those get weak. And I just saw a person in my clinic a couple of weeks ago. She's had 4 children right after each other. She could not sit upright. She had no strength to be able to just sit up. And I was like, oh my gosh, that's because we haven't been using that muscle for pregnancies and beyond.
And can someone bring that back afterwards?
It's not a forever thing, but why lose it in the first place is what I'm getting at.
Right,
And
right.
we are the only animals on this planet that when we get pregnant, the theory was, oh, stop, don't use those muscles. If an animal out in the wild gets pregnant, they don't change what they're doing. They're functioning out in the wild because they have to stay alive. And it was just a misconception that we had, that we perpetuated and got out there into the world. And now the newer research is telling us that's not correct. Okay. So I give everybody pregnant listening into this podcast permission to strengthen your belly during pregnancy. Don't worry about the doming. Just keep the doming soft. And what I mean by that is if you're doing a curl up, if you press down on the tissue that's doming in the midline of your belly, you should be able to indent it. You should be able to press it in. If it's super, super hard, I would maybe avoid that. But keeping it soft where you can press it and depress that tissue, you're going to be fine.
So, Lynn, you have a certification process that you offer to help birth professionals become birth healing practitioners. Can you share a little bit about that?
I just know that the work that I'm doing with my pregnant postpartum clients is so impactful that I'm excited about the practitioners coming and taking my courses. But I realize that when they come and take the courses, they don't learn everything. And so the certification process is to really help deepen their learning of this material. And so it's a certification process for people. You have to have a license to touch to be able to take my courses and my trainings. And so I do have a doula course. If someone's a doula listening in, you could take that course. But my other courses, you need to be a massage therapist, chiropractor, midwife, PTOT to be able to take my trainings because it's not taught from the ground up. You need to have that baseline knowledge that your license would provide. Anybody with a license to touch can take my trainings. And if someone is interested in becoming certified and really owning the skills that I teach in this course and being able to be the most effective in working with pregnant postpartum clients, they can offer that certification track. And those that have been certified, they've taken extra training, they've done a skills assessment test with me, and they've written up case studies so that I get a good sense that they know how to use this work and that they're using this work correctly. And so in my directory, those that are certified are going to show up first in any search, and they are at the top of the directory. So I would encourage you, if you do have someone who is certified near you, you definitely want to work with them first versus someone who's just taken my courses, because I can't guarantee that they're using it in the way that I taught it, but I can with the certified practitioners.
We've been speaking today with Lynn Schulte. She is a pelvic health physical therapist for more than 30 years. Lynn, can you share how people can get in touch with you if they want to learn more about your work?
Oh, thank you, Stephanie. For those practitioners listening in, if you have a license to touch or you want to check out my online and live courses, you want to go to the instituteforbirthhealing.com. That's my website for my educational platform. If you're interested in coming in and having a session with me, and that session can be done in person in my clinic in Longmont, or I can do live virtual sessions with people if you're dealing with trauma from birth, or you want to work more energetically with your body, I can do a session via Zoom. And that you can sign up for and schedule an appointment with me via the centerforbirthhealing.com. That's my clinical website. And then on social media, I'm more active on social media on the Institute for Birth Healing site. So all the social media is the Institute for Birth Healing. My YouTube channel, where all my videos are and educational videos are, is on my YouTube channel, Institute for Birth Healing.
Thank you so much for being here today, Lynn. It's been a real pleasure to speak with you.
Thanks so much, Stephanie, for having me. And thanks everybody for listening in. Please take care of your bodies.
Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.